Hello, everyone. Welcome for joining us for today with the Vancouver Coastal Health Intercultural Online Health Network Indigenous Health Round. We'll be starting in about 1 minute. We're just letting our friends in together, and thank you very much to all of you friends for joining us right now. So in about a minute, we will get started. Thank you. Okay, everyone, why don't we get started? First of all, thank you very much, everyone, for joining today's round, the VCH Icon Indigenous Health Round. Many of you are returning friends, wonderful. Many of you are also new friends. So it's just amazing for us to be able to welcome you here. My name is Kendall Ho. I'll first do a land acknowledgement first. I am calling in myself from the traditional, unceded, shared, ancestral homelands of the Musqueam, Squamish, and Tsleil-Waututh people. And today we're very, very fortunate to have Elder Bruce Robinson and Dr. Alana Hirsh, together with Leslie Blanchard and Sherry Barr, joining us today for today's presentation. I also want to acknowledge the collaboration with the Vancouver Coastal Health Aboriginal Health Unit, together with Ministry of Health Support, First Nations Health Authority, and the Vancouver Physician Staff Association supporting, with the Department of Emergency Medicine as the part of the ICON unit. My name is Kendall Ho. I am an emergency physician at Vancouver Coastal Health and a professor at UBC Faculty of Medicine, Department of Emergency Medicine. I am originally from Hong Kong, so very fortunate to be a settler here in Canada, and really looking forward to co-facilitate this round with Laurel Jebamani. Thank you, Laurel, for being here. I want to quickly mention that we are recording this session, and the reason for that is that we have been having a very good traffic after these sessions, the previous ones, that people would like to revisit, and also invite new friends to watch. And that's the reason for the recording. For the session, we absolutely welcome your questions, comments. We ask that you use the chat function of the Zoom so that you can put your comments there, and we will get to all your chats. Laura and I will facilitate and get that as soon as we can. Let me now introduce Leslie Blanchard, our Vice President of Indigenous Health and Vancouver Coastal Health, to give us some opening remarks. Leslie, thank you very much for being here. Over to you.
Thank you so much, Kendall. Hello, everyone. It's very nice to be here with you in this virtual circle. I'll just introduce myself and call my ancestors into the conversation. I'm Leslie Blanchard. I am Ceciletta Carson and Benson. I am a life partner to Mike, mom to Carly Clayton and Riley. I come to this work as the Vice President of Indigenous Health with all of that in mind and how we affect changes to the next generations to come. I am from the Nisga'a Nation, which is out in the Fraser Valley, and also the Nooksack Indian tribe, the other side of the border, and Italian on my mother's side. I just really want to honor and give gratitude to Kendall for his partnership all these years. We've been doing this for a long time now together, supported by my friend and colleague Laurel Jebamani, who I just want to give a special shout out to, who has been such an amazing partner and ally in this work since my Fraser Health days, and then over to Vancouver Coastal Health. And I'm so sad to say she's leaving our team and venturing off to a new role. So just want to say thank you so much, Laurel, for all your years of dedicated service to the Indigenous population and to Aboriginal health. Your talk today and your facilitation is going to be so important. I know you're talking about trauma-informed care, and this is something that's really gained a lot of acknowledgement and understanding over the last, I think, about a decade of talking about trauma-informed care. And I would just channel Elder Roberta, who says, it's not just trauma-informed care, it's history-informed care. So understanding the historical impacts to the Indigenous population and these different types of trauma that affect their ability to access care or definitely impede their wellness. So thank you so much for inviting all of us into this circle to learn a little bit more about trauma-informed care. And I wish you all the best throughout the session. I'm going to stay here and listen in, and can't wait to hear what you have to share. And I'm going to send it over now to Sherry to introduce herself and some welcoming comments. Thank you.
Thank you. And thanks for inviting me to provide a short opening welcome in today's circle. I'm Sherry Barr. I work on Patients as Partners in the Ministry of Health's Primary Care Division. Before I go on, I'd like to acknowledge and offer respect to the Lekwungen speaking people on whose traditional territory I'm located on in Saanich, and to the Songhees, Esquimalt, and Masonic peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Chartered Community. I was just thinking this morning how very fortunate it is to be here when we see what's happening in Europe right now. Anyway, I'm going to get away from that. I find it upsetting. Patients as Partners believes that we can make the health system better when patients and their families, healthcare providers, and community organizations work in partnership. Our patientsaspartners.ca website has resources and a calendar that describes free educational events, such as ICON's multicultural chronic disease self-management events that can benefit your patients and their families. Patients as Partners has collaborated with and funded ICON for over 10 years with Dr. Ho as executive director for all of this time. Even before the TRC, Kendall came to Patients as Partners with the idea of providing educational events and forums to discuss incorporating traditional Indigenous healing into Western medicine. We thought it was an excellent idea and asked ICON to start. Since that time, ICON has been very successfully bringing people together for discussions such as this one. However, as we saw from the In Plain Sight report, there's still much more that we can all do to eliminate racism in healthcare and achieve reconciliation. Thank you to the organizers and very much to the presenters today. I appreciate your time and I look forward to learning more from your experiences. Thank you.
Wonderful. Thank you so much, Leslie, and thank you so much, Sherry. Let me now invite Laurel, my moderator, to introduce herself, and really tremendous to have been working with with Laurel. Laurel.
Thanks, Kendall. Hi, everyone. My name is Laurel Jebamani. I'm a settler on unceded Coast Salish territory of the Musqueam, Squamish, and Tsleil-Waututh people. I am Tamil and Dutch ancestry. And as my VP Leslie mentioned, this is going to be my last Indigenous Health Round. It's been so wonderful to participate, and I'm glad I get one last shot.
Laurel, thank you very much, and it will continue to resonate with me with your partnership here. Let us go right into the rounds. I am very honored to be able to introduce Elder Bruce Robinson and Dr. Alana Hirsh. So for today's round, what we'll do is Elder Bruce and also Dr. Hirsh will be speaking for about 45 minutes or so that we have 15 minutes, we'll have 10-15 minutes of interaction before 1 o'clock. I know some of you may have to leave by 1, but we'll continue the session from 1 to 1:30 and continue to have dialogue together. So this is the approach that we're going to take. First of all, I'd like to introduce Elder Bruce Robinson. I'm very much a learner, so I'm going to ask Elder Robinson himself to introduce his own name in his language. Elder Bruce is a spiritual work has helped empower others to heal themselves through songs, smudging, cedar bowl brushing, And Elder Bruce is currently an elder and cultural advisor for Kilala Lelum in the downtown East Side Urban Native Youth Association and Broadway Youth Resource Center. I also want to introduce Dr. Alana Hirsh. She is a McGill and UBC-trained family physician and a UBC Clinical Assistant Professor with expertise in addiction medicine, emergency medicine, and trauma-informed care. She's practiced in urban and remote areas of Canada, US, and West Africa. She currently also works at Kilala Lelum Health Centre, Urban Indigenous Health and Healing Cooperative, as a physician for Drinkers Lounge, a community-managed alcohol program run by PHS Community Health Services. And so thank you so much to both of you for being here. Let me pass it immediately over to Elder Bruce to start.
Oh, good afternoon, everybody. I'll introduce myself in my traditional way. Sim Gigat, Sigidam Hana. We Lulayam Golf, Nakikwans Kne, Wolfs Nislishian from the Lakibu tribe. You know, Lakibu is wolf in our language. I'm from the Nisga'a people, as you heard, right? You know, and I was shipped off to go to school down here in 1970. And what I say to the youth is that, you know, Vancouver became a new village for me, not a home, but a new village. And you know, so I've been down here for quite a number of years, and I learned a lot, you know, in my travels around in the Lower Mainland. And, you know, and that my true name, which Wilulayim Golf Nikilkwans, means grizzly bear with a big heart. And Nislishian is our chief, and his name means where the minks gather. It's a very sacred place. It's a very sacred place. I'm going to sing, this song came to me. It's a forgiveness song, you know, and I kept singing it after I, you know, was having, you know, after my 30 years of I'm still on my healing journey, but after 30 years, I didn't think anything would affect me. But when Kamloops 215, what they called, I always call it the so-called discoveries, right, of the children in the graveyard, right, you know. But it's in that understanding our people have always known they were there. And, you know, the stories have always been handed down because, you know, it's been sometimes they've been there for a century. So you can imagine how long these stories have been handed down. And, you know, I call them the so-called discoveries because humanity is now finding out what the true nature of residential school, the main purpose of it was, right? You know, and it's in that understanding and how that it can make a, you know, a big impact on our people. Right? You know, and I kept asking what this song was about, and it's a song of forgiveness, right? You know, that it's to ask the children to forgive us for not recognizing them sooner, right? Not bringing them, you know, to light, right? You know, but then I started looking at it, you know, and all the things that I'd done in, you know, when I was in my own addiction, right? You know, there was a lot of things that I needed to forgive myself about. You know? So it's in that understanding that, you know, we all have things that we need to forgive ourselves for, right? You know, so, and as I sing my song, you pray in your heart in your own way for the things you're looking for yourself and for others. And, you know, I'm just so grateful that we can still gather, you know, in some kind of form, you know, because this is a sacred circle. You know, a sacred circle, when we gather in a sacred circle, there's no one above and no one below. We're all equal, right? You know, and that's why I always say that, you know, my hope is that, you know, these sacred circles will reach out to every single person on Mother Earth so we can all get along together. And, you know, so it's in that understanding and how that, you know, I always say I am of the Nisga'a people. I don't say nation. Because if you look at all the nations on Mother Earth and how we isolate from each other, right? You know, when we say we are people, we are all one. We're all one with each other. You know, if we can all walk together in a good way, right? You know, so as I sing my song, you pray in your heart in your own way for the things you're looking for yourself and for others. Anybody that, you know, pray in your own heart. When one prays, it's powerful. But when we gather like this in a sacred circle, when we pray together, right, it's more powerful, you know, and it can affect everything in life. It can affect everything in life. Great spirits, grandmothers, grandfathers, so grateful for today, so grateful for everything you have given us in our lives, so grateful for bringing us together in a good way with a good open, good heart. I ask that you join us as one throughout Mother Earth. Join us as one in this sacred circle. Join us as one in soul, heart, and mind. Join us as one so we can have good understanding of each other, so we can heal each other, uplift each other, to walk in harmony with each other, and to walk in harmony with our beautiful and loving Mother Earth. Mother Earth, please forgive us for anything we've done to harm you in any way, Mother Earth. Please forgive us. And be kind and gentle to us when you bring back balance in this area, Mother Earth. Be kind and gentle to us. We love you and honor you, Mother Earth, for the sustenance of life. We love you and honor you, Mother Earth, for all our lives. So grateful for the people of these lands and the ancestors of these lands, which is the Coast Salish people. So grateful for all our ancestors, for without them we would not be here today. So grateful for your guidance, your wisdom, and your knowledge that you share openly with us every single day of our lives. Guide us well, great spirits, grandmothers, grandfathers, through life. Guide us well in all the good things we're going to do for ourselves. Guide us well in all the good things we're going to do for our families. Guide us well in all the good things we're going to do for our friends and relatives. guide us well through life, great spirits, grandmothers, grandfathers. Guide us well in all the good work we're going to do for all the ones we're going to be helping. Guide us well, great spirits, grandmothers, grandfathers, through life. Oh, oh. Oh, thank you, great spirits, grandmothers, grandfathers, all our relations, you know. And it's an honor to be here today, you know, to be with some great people here in the sacred circle, right? You know, and I will stay unmuted so that whenever we're talking together here with Alana, right? You know, I'll pass it over to her.
Thank you, Elder Bruce, and thank you for that incredible opening prayer. Thank you to all of the organizers of these rounds. It's truly an honor to be here. I'm very happy and very humbled to have been asked to present, and I'm so grateful to be presenting with Elder Bruce, who has been a wonderful mentor to me. I'm going to share my slides. So I can't actually see anyone. So please do let me know if you have any trouble seeing anything. And Elder Bruce has promised that he will interrupt whenever he feels that it's necessary to keep me honest. So thank you so much.
You know, whenever we do these things, right, you know, and that, you know, when we're talking about Indigenous patients, right, you know, you're talking about me. You're talking about my family. You're talking about, you know, my friends and relatives. Like, you know, you're talking about all our people. Okay.
Thank you. So, Elder Bruce, you just brought up the first acknowledgement I want to make, which is the most obvious. I am not Indigenous. My family we are settlers of Polish descent. My family came here fleeing the Holocaust, and we are grateful, uninvited guests on the traditional territories of the Squamish, Musqueam, and Tsleil-Waututh people. As such, I am going to be presenting from the perspective of a settler, and I am a beginner and a learner in this learning about Indigenous culture. I present not as an expert in Indigenous trauma-informed care, but as someone like many who are probably attending today, I'm learning mostly by making mistakes and by having an incredible, competent team of forgiving and caring and brilliant people around me at Kilala Lelum, where I'm surrounded by elders and incredible colleagues and wonderful patients who are open to teaching me. So this talk today is a synthesis of what I have learned and what I have read and what I have heard. And I hope that in sharing it, it will benefit your practice as much as it has helped mine. I am a physician at Kilala Lelum, which is the Urban Indigenous Health and Healing Cooperative, and I also provide care at the Drinkers Lounge, a community managed alcohol program, which is run by PHS. I'm a UBC Clinical Assistant Professor, and I have no financial disclosures to make. So why are we here today? In 2020, the Honorable Dr. Turpel Lafond was commissioned by Dr. Adrian Dix to conduct a review of the state of healthcare for Indigenous people in British Columbia. And what her team found was extremely distressing. They found widespread stereotyping, racism, and profiling of Indigenous people. This limited access to medical treatment and negatively affected the health of Indigenous people in BC. Indigenous women and girls were disproportionately impacted. Public health emergencies were magnifying racism and disproportionately impacting Indigenous people. And our Indigenous colleagues, the Indigenous healthcare workers and students, faced significant racism and discrimination in their work and study environments. Now, trauma-informed care prioritizes the need to create an emotionally safe environment based on an understanding of the root causes, symptoms, and health effects of trauma. But how do we go from the findings of the In Plain Sight report to emotionally safe care? If all we needed was instructions, we have plenty of those. There's recommendations in the Truth and Reconciliation report and in the In Plain Sight report that we could follow. It's certainly not for a lack of good intention. We've seen the heart and soul in the healthcare provider and allied provider world in the course of this pandemic. But what I believe the problem is that we continue to operate from a colonial mindset and within a colonial system that is inherently racist. And the problem is, on top of that, that because we're so deeply entrenched in it, we can't even see it. So what I'm hoping to go through today is to learn how trauma to Indigenous peoples incurred by colonialism impacts their perception and experience of healthcare, to reflect on how settlers have been impacted by colonialism and how colonialism impacts our delivery of healthcare, to appreciate how this sets up a pattern of dysfunction and a lack of safety for Indigenous people, and learn how to break this pattern. So just to make sure we're all starting on the same page, I'll just do a quick definition of trauma. Trauma is an ambiguous term, but I like the Substance Abuse and Mental Health Services Administration definition, which defines it simply as an event, an experience, and effects. So events that are physically or emotionally harmful or life-threatening. They can be a single event like a car crash, chronic events like domestic violence or war, and particularly toxic is when chronic events happen over the course of childhood. So multiple events that start at a young age caused by adults who should have been caring for the child. And this is known as developmental trauma. An experience that overwhelms a person's ability to cope. And how someone experiences an event is often related to their age, their social supports that they have. And finally, trauma has effects on a person such that it impacts their functioning, mental, physical, social, emotional, or spiritual well-being.
You can hear it, right? And that it's, it's not about the addiction, and that it's not about the drugs, right? And that it's about how, someone is coping through life, right? It's just like, sometimes when we, what I used to do when I used to have a hard day, right? I used to have about 3 or 4, sometimes a half a dozen beer after work, right? But it's in that understanding that, I never really looked at it, and that was every single day, more on the weekend, right? So it's in that understanding and how that I was trying to cope in life. But then I never really looked at it, as being an alcoholic, right? Until I stopped. Right, so it's in that understanding of that and how that we all try to cope in life, right? And that, and some use different ways of, coping in life, right? So it's not about the addiction, it's not about, the drugs. Okay.
Thank you. In terms of the particular roots of Indigenous trauma, I think it's pretty clear that the roots of Indigenous trauma are from colonialism. When the European settlers came to North America, they were completely ignorant of the ways of the Indigenous people, and they brought diseases that wiped out huge amounts of people. They caused a systematic loss of culture. They denigrated women, forced relocation. There was legal discrimination, heavy use of incarceration, residential schools, which from everything I've read and heard sound more like child prisons. 60 Scoop removed about a quarter of Indigenous children from their homes. And then very important for us to consider is the abuses that happened under the healthcare system, which is that Indigenous people had to go to Indian hospitals, which were set up to allay white people's fears of being mixed with Indigenous people. They were hugely underfunded, and Indigenous people were often subjected to research without their consent, both the patients in the hospital and sanatorium, as well as the children. I appreciate this quote from Rupert Ross. Youth never got to hear the words of their elders, never got to understand their language, their history, the lessons learned, or the sacredness of life. The connections between generations suddenly ceased, leaving everyone gasping for spiritual breath and confidence in the future. Everyone and everything was suddenly disconnected. The medicine wheel had been broken. As Elder Bruce just pointed out in sharing some of his personal history, thank you, Elder Bruce, the impacts of trauma reverberate through someone's life. As the study done, the well-known Adverse Childhood Experiences study, the ACEs study by Folletti and his colleagues at Kaiser Permanente showed when someone experiences trauma throughout childhood, including something like being removed from your family home, being neglected, being abused, that has social, emotional, and cognitive effects. It impairs someone's ability to function and think properly. I'm going to skip my next slide for the sake of time and just describe it. The impacts on the brain of someone who goes through trauma involve creating a hypersensitive amygdala, which causes someone to constantly feel like they're in a state of fight or flight. It affects the hippocampus where our memories are stored. So people are constantly dealing with intrusive memories and re-experiencing and nightmares. And so of course, it's very natural, as Elder Bruce said, that someone might turn to alcohol or substances. And so people have a higher risk of adopting health risk behaviors, which leads to more risk of disease, disability, and social problems, and early death. Other studies have also shown that these traumas don't even have to be, the original trauma doesn't even have to be experienced by future generations to impact them, both through genetics, as shown by Yehuda and colleagues, as well as through the obvious behavioral impacts of being raised by parents who didn't have exposure to proper parenting skills or who might be suffering from substance use disorder. The effects of trauma continue to expand through generations.
Yes, right, and that, because I know you guys talked, I think it was the last session that you guys did was about intergenerational effects, right? But it's in that understanding, not one single person on Mother Earth gets away from the intergenerational effect, right? What you learn from your parents, their parents, it goes back through generations, right? It's in that understanding that, you're learning about others, right? Could be all good things, or it could be the total opposite, right? So it's in that understanding, if it's the total opposite and it's not all that great, when you see somebody that, you have these feelings about, right, it becomes judgment. When it becomes judgment, you can't work with them very well, right? Until you start to change in how you see them and how you feel about them. So not one single person on Mother Earth gets away from the intergenerational effect, right? We're all a product of that, of our parents, their parents, their parents, their parents.
Thank you. This is a study that I thought was helpful to understand how going through trauma completely alters people's perception of what is going on in the world and their safety in it. This was a study done by Bessel van der Kolk and Nina Fish-Murray at a children's hospital in Boston, where they showed a bunch of photos to two groups of children, one control group that came from relatively safe, healthy families, and the other group was of kids who came from severely abusive backgrounds. And so they showed them this picture and said, describe what's happening. And the kids who came from a control background, from a relatively healthy background, described the scene as, oh, you know, the two kids are helping the dad fix the car, they'll probably go to McDonald's after, and so on. The kids who had come from the abusive background described some gruesome tales. One of them said, oh, the little girl is about to smash her father's head open with a hammer. And another kid said, oh, the boy's about to kick the jack out from under the car and it's going to crush the father and stuff will be flying everywhere. And so, you know, I thought this was interesting because it shows that even seemingly benign environments can take on a whole new meaning for people who have been through significant trauma. So this brings up a really important question for us in healthcare, given that Indigenous people experienced harm in the hands of healthcare workers. How is healthcare experienced by Indigenous patients? So there's two studies that I thought were helpful to bring up, both of which were conducted on the West Coast. The first one by Brown and colleagues was a qualitative study that was done in a large Western emergency department, where they interviewed about almost 50 Indigenous patients, as well as their healthcare providers and some objective observers. And in this paper, they discussed the Indigenous patients' perspectives on their care. The overriding theme was the patient's concern with how healthcare providers might be responding to them on the basis of their appearance. Patients' concerns centered on the potential dismissal or diminishment of their health issues because of how they'd be read by providers. They were extremely attuned to providers' verbal and nonverbal gestures and the vibes that providers conveyed. And on a positive note, they also mentioned how significant it was when providers conveyed concern, even like just simply by offering a snack. In the other study by Goodman, this was a study that was done as a focus group study with Indigenous patients who also had substance use disorder in the downtown east side of Vancouver. In this study, patients felt they were treated differently in their healthcare interactions. There was a collective narrative about the adverse care others had experienced. They felt hospital policies were cultural barriers to health and wellness. One person described not being able to smudge and how important that is to their healing. While some participants were able to put up with it, others avoided the healthcare system altogether or only sought healthcare once their condition had become severe. So in answer to the question, healthcare does not feel safe to many Indigenous people. Now, as I mentioned before, you know, we've been given instructions and we have the right intention, but I think the crux of the problem comes down to this well-known quote by Albert Einstein, that we can't solve our problem with the same thinking we used when we created them. See, our current understanding and mindset are grounded, and practice rather, are grounded in a colonial mindset. Colonialism isn't simply the physical occupation of land. It is a process, an operation of power in which one cosmology is extinguished and replaced with another. So our entire worldview is impacted by this colonial mindset that we've been raised in as settlers. And I realize I'm generalizing here, but bear with me. In general, the colonial mindset is scientific. We believe that there's one truth that we use the scientific method to uncover. The colonial mindset believes in individualism. So our society is set up as a hierarchy and we compartmentalize. And we see this even how doctors approach patients and diagnosis. We try to isolate the disease within the body and the organ, rather than taking into account the wider social determinants of health and history that go into creating disease. Human beings are the most important in the world. Land and natural resources should be used for the benefit of humans, and time is linearly structured and future-oriented. The Indigenous worldview, and again, I'm generalizing, is spiritual. Of course, they believe in science, but spirit is really at the forefront, and there can be many truths depending on a person's experience. They believe in relatedness. Society operates as a circle, and one is only as well as one's community. Human beings are not the most important in the world. Land is sacred, and time is nonlinear. So obviously the mindset of the colonial mindset that we come from impacts our practice. So this is an interesting study that was done based on the same data as we saw in Brown's study earlier. This was a paper written by Tang and colleagues about what was the provider of the healthcare, what was the perspective rather of the healthcare providers that were interviewed in that emergency department. Well, many of the healthcare providers expressed that the social or ethnocultural background of their patients had nothing to do with how they would be treated. And healthcare providers often made mention of treating everyone the same, including patients who are Indigenous. And sameness here carried a positive connotation to imply that Indigenous patients are receiving equally good care as their non-Indigenous counterparts. And this is very consistent with the predominant discourse in Canadian healthcare that all people are treated equally. But this brings up two questions. One, is treating everyone the same an adequate way to respond to inequity, including racial discrimination? And two, is treating everyone the same even possible? Are we impartial? So I want to just do a quick little mental exercise right now where we imagine that Dr. Smith walks into a room and says, "Hi, I'm Dr. Smith. What can I help you with today?" So let's imagine that he does this with the first patient, Mrs. H, who is my mother. My mother works her way into every presentation I give somehow. And I need to talk to a therapist about it, but she does. So Mrs. Hirsh is seen by Dr. Smith. My mom she came here, as I mentioned, while her family was fleeing the Holocaust. She was raised in a refugee camp until she was 5 years old. She suffered from malnutrition, TB. She has her share of trauma, but she has memories of being rescued by Caucasian Red Cross men. And she has other memories of coming to Canada and again being rescued from bankruptcy by the socialized healthcare system. And so you can imagine when Dr. Smith walks in the room that her amygdala and her overall feeling is going to be one of safety and trust, and she's going to feel good and able to disclose her medical history and accept his diagnosis. Now, I want you to imagine the same scenario, but with an Indigenous woman. "Hi, I'm Dr. Smith. What can I help you with today?" She may not feel quite so comfortable disclosing, and her amygdala might be sending off very different messages. So you can see here that treating everyone the same may not be appropriate when you talk about trauma-informed care. And I'm wondering, we could just put in the chat, I'd love if people could just suggest what are some things that Dr. Smith could do to help this Indigenous woman feel a bit more comfortable and safe. And since I can't actually see the chat box, I don't think, I'm gonna just ask whoever's monitoring it just to mention if anyone puts anything down.
Alana, not yet? Ah, okay. So Alana, one comment is listen carefully. And second one is assume everyone has trauma. Oh, lots coming. Would you like me to just read all of them out? Some of them short, some of them long.
Well, I can see the numbers of chat. So there's a lot. Maybe just throw out a couple of examples and then I'll move on because I know we only have so much time. But thank you everyone for participating. I'm so grateful.
Yeah, so maybe a couple of quick one. Two-person says take off the white coat. And the other one is ask if she would like to have someone else present in the room. And also having the doctor sit down and asking for permission to join the patient for discussion and deep listening. So maybe I'll throw those out.
Thank you. Those are fantastic suggestions. And yeah, I mean, a couple of others, could be also considering the signage in the room, maybe making the examining room have obvious signals that would make, maybe a poster of something related to Indigenous culture or doing a land acknowledgement or something that would make people aware that they're in a safe place. Introducing himself as well as more than simply Dr. Smith, perhaps also situating himself as a settler and maybe as a father or as a human being and conveying that he understands that we're a product of all of our relations. So some of those things might be helpful, and I appreciate everyone putting thought into it, and I'll look through the chat carefully after, and I appreciate you thinking about it. The next question that came up is, are healthcare providers impartial? Unfortunately, the evidence indicates that healthcare professionals exhibit the same levels of implicit bias as the wider population.
Yeah, because I used to live in Burnaby years ago with my late wife, and when my children were younger, right? And that. I had a young man. He could barely speak English, right? And I asked him where he's from. He said from Korea, and he kept looking into our home when he was delivering our pizza that we ordered. He kept looking at our home, and I said, "Oh, is there something I can help you with?" And he said, "Aren't you Aboriginal?" And I said, "Yes, I am." Well, I thought you guys got all your homes free, right? So you can understand where these teachings are coming from, right? And it's from the government, right? So like I pay taxes, I pay taxes, I pay, for everything that I have and everything that I need, for my family, right? And that, so, right? So it's an understanding that, where it comes from.
Yeah, thank you, Elder Bruce. That's a perfect example. Implicit bias comes from exactly what Elder Bruce was just referring to, which is just the messages that we get, the cultural conditioning that we get throughout our life. Implicit bias is the attitudes and stereotypes that affect a person's understanding, actions, and decisions in an unconscious manner. And really interestingly, they can be in direct contradiction to a person's conscious beliefs and values. They're due to cultural conditioning, which is just a product of being human. We're affected by the messages that come to us, both explicitly and implicitly, from our parents, our education, the news, advertisements, and unfortunately, these messages seep into a person's affect and behavior, even though they're outside the full awareness of that person. And cultural conditioning also applies to race, which is known as racialization. If we were raised in the West, we learned, consciously or not, that white was better than non-white. And even if we endorse egalitarian values and consciously do not believe racist ideology is true, we're all likely to have internalized some of it. The image of the drunk Indian is one of the most enduring colonizing images pervading Canadian public perceptions. And so even though we consciously understand that it's completely related to colonization and the effects of childhood trauma, nevertheless, it impacts our implicit bias and thus our decision-making, and it continues to have devastating consequences. There's multiple stories of Indigenous people being mistakenly assumed to be drunk when they were having a stroke or shock. Worst comes to worst, patients sense our, worst of all is that patients sense our implicit bias, even if we're not aware of it. I'm just gonna speed through that slide because we're in a bit of a rush. Activators of implicit bias, this is important to know because the activators of implicit bias are exactly the conditions we deal with in healthcare. Fatigue, time constraints, information overload, emergency department overcrowding. Those are all the things that we deal with and that make us more likely to rely on our unconscious thinking. So regardless of our intent, healthcare providers do not treat everyone the same. Now, I think this is a good moment to breathe because none of us like to consider that we could have a racist bone in our body. And I want people to know that I'm not here to shame us. Shame is the idea that we are bad, and we're not. But I think it's okay to acknowledge that we did something bad, which is what guilt is. But I believe that guilt can be a good thing. It can be used as a moral compass. And I'd like to give some instruction that I think can help us move guilt into action. We all make mistakes. but the question is, how do we repair them? So I hope after what I've demonstrated that you will believe as I do that trauma-informed care for Indigenous people is decolonized care. So how do we decolonize healthcare? When I was reading up on presenting, there was lots of advice on making cute acronyms or rhymes for people to remember your take-home points. So here's my reflect, recognize, reconfigure, and relationship action points. So reflect. Be aware of your own cultural values and the impact that colonial mindset has had on you. We practice Western medicine. We likely believe in the superiority of Western medicine. Know the organizational culture of where you work, the attitudes towards time, the expectations of dress and behavior. Something you can try. Assume that you have implicit bias. And know that if you're busy or stressed, you're more likely to make decisions based on your unconscious thinking. So, you know, if the emergency room or work is such that that things are a little hectic, just be extra careful. Take a little more time. Recognize the value of Indigenous healing practices. To counter the stereotypes in your head, learn about the culture through the eyes and words of people within that culture. Something you can try is to read books by Indigenous authors, to speak with elders, and ask people and patients about their spirituality and cultural practices and how these practices enhance their life. Reconfigure. We need to dismantle the power dynamics created by colonialism. And this means meaningful inclusion of Indigenous leadership, not just inviting Indigenous people to assimilate into alienating academic environments, but truly building a system of healthcare in which Indigenous voices are integral to the decision-making processes in both healthcare delivery and governance structures. This will require institutional recognition of Indigenous ways of being and knowing and approaches to deliberation in the healthcare setting. So I think it's important that we try and demand having elders on boards and having elders be available to our patients. And this will require an openness on our part because it may involve doing things that feel awkward, like taking more time or healing in different ways. And we just need to work on maintaining an openness to this. And finally, relationship. Building good and right relationship reverses the colonial structures that sought to convince us that one of us is better than the other. Decolonizing medicine begins with the project of rehumanization and reconnection, linking scans to people's faces, patients to their families, their cosmologies, communities, and histories, peoples to their land and mountains and waters, and relatives to one another across the vast web of life. Try this. When you introduce yourself to patients, introduce yourself as more than just a professional. Do both a personal and professional introduction. Situate yourself as a settler if you are a settler. Ask people about their cultural background and maybe share a bit of yours. I've been lucky enough to see the benefit of these practices at Kilala Lelum, where we partner Indigenous elders with inner city physicians and allied health professionals, and where elders provide direct care to members along with the physicians. They do mobile outreach to meet patients where they're at. And there is also a whole relational care team and cultural programming to also bring culture into people's health care and lives. They've started an amazing canoe program so that patients can go on journeys and reconnect. And finally, what are the benefits of decolonizing healthcare? Firstly, and most importantly, I think decolonizing healthcare will create better care for our Indigenous patients, emotionally safer, more appropriate, more accessible care, which will lead to better outcomes. And this will be a lot of work. It is difficult for healthcare providers to do things differently and to change the system that we work in. However, I'd like to reassure you and inspire you that the benefits are to us as healthcare providers are actually huge. Incorporating an alternate worldview that encourages greater connection to the earth, spirit, and all our relations may be a better way for us to live. And practicing in this way also allows us to be human, which I believe is an antidote to burnout. I want to thank Elder Bruce and Lexi Fisher for their help, and Dr. David Hall for being such a great mentor. And Dr. David too for being such a great mentor, and David Hall for suggesting me for this talk, my Kilala Lelum team, my patients, and the organizers of these rounds. References will be available if needed, and Elder Bruce and I welcome your questions and really appreciate your attention.
Yeah, because when the In Plain Sight came out, right, and that it's brought to the forefront, and what was happening to our people in emergency rooms and in the hospitals, right? But it's in that understanding that it doesn't have any real teeth to make change, right? But it is there for you, right, to make change, right? You are the system. You are the system, right? You guys, you all hold great power. You all hold great power. You can make that difference in making change, but that's up to each individual, right? That can make change, right? And that we had a visitor from with one of the talks I did with Dr. Tu, right? One of the doctors was so, wanted to come to our clinic and, to have a visit and see what we were doing. And, and he said, so she came, right? So she was working at Royal Columbian, right? And she said, how do I start? And I said, well, it starts with you. You can start with just one, right? Then it starts with the next one that you bring in. It starts with 2 and then 3 and then 4. Right, because you see, it's in that understanding that we are all family. I worked a lot with Vincent Stogan. He's an elder from Musqueam, right? We'd go to different gatherings and where he was doing speaking and everything like this, and he'd look out and he'd go out and start talking. He said, family. The first thing he said was family, and I always looked out in the crowd and see which one of his family was there. But he was talking about everybody there. We talk about reconciliation, right? Reconciliation, right? But it's in that understanding that, I went and did a teaching at, one of those, middle schools, right? And they had, it's middle school and high school, right? They wanted to know about reconciliation, and I said to them, reconciliation is when we can put our differences aside. When we can all put our differences aside, right, and just be with each other from our hearts, right? Because it's in that understanding, we are all one people, right? We are the human race, That's why I always say I am from the Nisga'a people, right? I don't say Nisga'a Nation. Because we got to stop separating ourselves. We have to stop separating ourselves. If we keep saying, and I'm so honored to be here today, and that, you're all here. You can all make change, right? So it's up to every single individual person to start to make that change, and it's not just for our people. It's for everybody. It's for everybody, right? Because we're all in this together. We're all on this journey together. And especially with what's happening in in Eastern Europe, right? And that because when I say when we get together, when one prays, right? It means it's very powerful when one prays. But when we all gather like this in a sacred circle, right? When we're all praying for peace, that peace, that prayer reaches out to can even go into the universe. Right? That's how powerful we are. I always say the most powerful thing we have, right, is within us. It's our soul, our spirit. And it's connected to the spirit that is in all things, which is creation or the creator. Right? That's why I always say, like, this happens to every single person on Mother Earth. Spirit coming into being, spirit coming into being. Baby, very first breath, very sacred. Right? That happens to every single person on Mother Earth, no matter who you are, where you're from. Right? And then as we travel through life, could be a short life or a long life. And then, very last breath, very sacred, spirit returning. It's a transition into life, transition back into spirit. We were taught, differently about what they call death, right? We were taught differently about what it truly is. We were taught to fear it, because, but, I don't fear what they call death because it's a transition. I've been to the bedside of, not only my loved ones, but all different ones that ask me to come to be with them, with the family, when somebody's ready to transition. And that room fills with love. That room fills with love when they transition, right? So it's in that understanding that, I don't fear death, what they call death, but I will fight like crazy to live, right? I will fight like crazy to live, right? And that, so, and it always makes my heart feel, really good when we can come together still in this time, in a good way in this sacred circle, because in a sacred circle, we're all equal. We're all equal, right? And I'm so honored to be here today.
Oh.
So any questions? I know everything, so you can ask me anything.
Thank you, Elder Bruce. Thank you, Dr. Hirsh. Really, not only is I feel my knowledge is filled, thanks to both of you. I also feel my heart is filled with your authenticity. Thank you very much for being here. Really appreciate it.
Thanks, Kendall. So the first question that came up was with regard to eye contact. When you have an Indigenous patient coming to see you, is eye contact a good thing or is it a bad thing? And if it depends on the context, how do you suss out whether it's a good or a bad thing?
Well, you can usually tell by the person, right? And that, because a lot of times they won't have eye contact, right? Because, it's in that way that, how we were made to feel about ourselves. That's why I say, like, the teachings I give, a lot of the young ones now, right? And that is, since the so-called discoveries have come out, right? Is that I keep saying that, we are not residential school. We are not colonization. We come from great people, right? We're great medicine people. Mother Earth has always been our pharmacy, and she will be. And that's where all your medicines come from. But it was changed. It was changed to a chemical. And when it was changed to a chemical, the spirit of it was taken away. So it's in that understanding when we go to harvest our medicine, right? We give great gratitude, we give a love offering, we give all these things, we give it the intention of what we're going to use it for, right? So it's in that understanding of that spiritual connection to everything in life, right? That's why I say, like, we're all spiritual beings. We all come from spirit, right? So it's in that understanding of that, right? I also said to some of the doctors, I said, why is it so hard not to pray for somebody if they come in, right? You don't have to pray out loud. You can just pray for them when they come in, right? Because that's a spiritual connection, right? And that's what is taken away, in everything that you've learned in the medical system. You don't learn about the spiritual part of a person, right? And that's the most important one because it's connected to everything in life. Everything, the air, the water, right? And that. So, right. And, it's, you know, even our thoughts can affect others, right? You know, because, you know, I always talk about, you know, the Japanese water experiment. Have you guys heard of that? Japanese water experiment, right? Where they had, you know, a bucket of water. They took 2 cups, put them in different rooms, but before they did, they looked at it under a microscope, right? You know, and that they took one in one room, gave it all this ugly stuff, right? You know, everything they could think of, all this ugly stuff. But in the other room, they gave it all this good stuff, right? You know, and that everything in love and everything they could think of, it was all good. Right, you know, when they look at it under the microscope, and you know, the ugly one that they gave all the ugly stuff to was murky. It was, you know, all the water crystals were you know, shattered. Right, then the other one was almost pristine. Right, you know, it was more clearer than what it was before. Right, and what are we made out of mostly? Does anybody know that?
Yeah.
Didn't you guys learn that?
Yeah, water.
Yes. Right. Right. So that's why I say belief is a powerful thing, right? Before we even believe in whatever we call our higher power, right? You know, we believe everything about ourselves first. You know, so it's in that understanding the effects that belief can have in our own physical well-being, right? Because of what we're made out of. Right, you know, so if you're, you know, that's why I always say, like, one of my mantras, I always say, I put it in that way, right? One of my mantras is, I am healthy, I am healthy, I am healthy, I am healthy, right? So it's in that understanding in what you're saying about yourself, right? You know, it could be all the good things that's here, or a lot of times all we see is, sometimes they call it blinders, right? It's all the things that we've gone through in life. Right? You know, that's why I say belief is a powerful thing. Believe in all the good stuff that's here, all the good stuff that's within. Okay, I'll shut up now.
No.
I can say a lot more. I can say a lot more, but now I'd like to, you know, hand it over to Alana for a bit here.
Yeah, thank you very much. Alana, your comment?
No, I have nothing to add to that. I think Elder Bruce, you know, with respect to the original question of eye contact, is I just agree with the things that you've said, and just in terms of practice with what Elder Bruce was saying about the spirituality. Elder Bruce encouraged me to ask my patients about their spirit and spirituality, and it's been really welcomed by my patients and has led to some wonderful discussions. You know, some people feel very connected to spirit and to culture, and others don't, but were interested in learning more, and so I was able to refer them to the elders or to different groups. So yeah, it's been a wonderful practice to incorporate.
Wonderful. I really, again, thanks to many people who shared experiences on the chat. One of those experiences I think I'd like to get your comments, Elder Bruce and Dr. Hirsh, is that this person feels that there's a bit of struggle to reconcile the love and patriotism to the country that promotes multiculturalism, yet there are some oppressing Indigenous people even to the present day. And this is a challenge, and it's an important one. Any advice in dealing with this challenge? Welcome your thoughts.
Yeah, because, you know, I was in a group of really some, you know, young people, right? You know, some youth, right? You know, and that, and, you know, and we started talking a little bit about, you know, decolonizing, right? You know, and that, and, you know, I always said that, you know, I always have a hard time with the word indigenized. So what he's trying to do, become an Indian, right? You know, so, but as, you know, when I started talking about decolonization, right? You know, and that, this young lady spoke up, right? She said, you know, a lot of our people need to decolonize themselves too, right? And, you know, it almost made me think, but that's impossible, right, for me, right? You know, and that, but you know, but it's in that understanding that, yes, right, you know, I always say that, you know, a lot of us have learned too well from Western society, right? You know, and that, and how that we see and do things, right? You know, and then one time, you know, there was when we were talking about, the pipelines and everything like this, right? And that, one of them said, well, all the Indigenous people are taking advantage of cell phones, cars, and everything like this. And I said, yes, but that's this lifetime right now. But I said, what I would like to do is just go back and have a pristine Mother Earth, and just to be able to live off Mother Earth, right? To be in harmony with Mother Earth, right? Because as you can see and know and understand of how we've abused our mother, right? I always talk about how a lot of our elders and our ancestors have said, we have to take care of Mother Earth for our children's children. But we're not just talking about our own children's children, because your children's children are going to live on Mother Earth. So what are we going to leave them? Right? Right? These are the things that we have to look at. For our younger generation, what are we going to leave them? Right? It's not just our children's children, right? It's all of us. That's why I say, we are all one. We're all one people. Right? We can all make that change for each other. Okay, pass it over to Alana.
Thank you. I just want to clarify the question. So was the question that how do we reconcile having a love for the country that we've been raised in and that, has given us many things, with at the same time accepting that that country has done horrible things to Indigenous people? Was that sort of the question?
Yeah, it's a sharing of that sentiment, the sentiment that I love my country, the country loves my culture some, yet we still see this happen.
I have great compassion for that question, and I will, with great humility, confess that I used to have a great deal of difficulty calling myself a settler because I found the word really weighty, and I didn't want to connect myself with it. I didn't want, I felt like no fair. I came here my family came as refugees, and I didn't do that stuff. And I didn't want to connect with all of the history associated with being a settler. And it takes time. It takes time to learn how to reconcile that within you, to realize that I am connected to that. And to be able to, I think that's where differentiating between shame and guilt is helpful. To realize that I'm not bad and I did something bad. Because of all our relations, I can't separate myself from European settlers. I still am connected. And as such, I have benefited and I have responsibility to be of assistance to re-equilibrate the country that I live in. So I feel like there is a way to carry both the guilt that we have and the things that we have done wrong, and the fact that we have also had wonderful experiences in this country, and we have benefited from being settlers in this country. And it's messy, but we can hold it all together, and that's where I think the reconciliation will happen. And if we can hold it and we can all be in relationship together, and equilibrate and help to equalize society such that our Indigenous relatives are given the support and treatment and healthcare and so on that they deserve and that they have been deprived of, we're going to be an even more amazing country and family. So it's a big, weighty question. But now now I'm happy to be part of the process and to sit with that guilt and move it into action.
Thank you. Thank you very much. Momentarily, I'll pass to Laurel for the next question. There are a few people who indicate they'd like to see the chat, and we will be capturing the chat into a document. And so you're welcome to copy and paste yourself, but we will be doing that. Laurel.
Thanks, Kendall. So Alana, you mentioned in your presentation the In Plain Sight report, which cataloged a lot of experiences, not only among Indigenous patients, but also Indigenous care providers. And I received a question about what you should do if you have a patient who requests a white physician or a white care provider and doesn't want to be treated by your Indigenous colleague. What would you recommend the response be?
So I think that's basically the question is, how do you deal with racism in patients? And my instinctual way of how I deal with racism in patients is usually, I'm thinking I haven't had that particular instance, but, I've had it with colleagues who are, of other backgrounds. And usually I go and I just talk to the patient and have a frank discussion with them about how that's not an appropriate request, and how we're all a team and we're all equal. And, if they want to receive healthcare, they need to treat each of us with respect. So, that's how I've dealt with it in the past. I think it would be kind to ask the patient if there's a particular concern they have, to maybe enlighten them as well and have it be a teaching moment. And in some cases also, my colleagues haven't been comfortable working with the patient after that experience. But I do think it's important to educate patients that that's not appropriate and won't be catered to. Do you have different thoughts, anyone?
So what kind of patient are you talking about? I mean, are you talking about a white patient or yeah, yeah, right, and that, and I've gone to a lot of different places, and I've done a lot of different things with the work that I do is spiritual, right? So that's why it works for everybody, So I've helped every, ethnic background that you can think of, right? I never turn anybody away, right? But you see, that's me, right? Because it's an understanding of where it all comes from and where it all goes, right? But it's in that understanding, yes, right? It depends on, it's to educate, right? It's to educate, right? Because I know a lot of our loved ones that have PhDs, right? And that, so, right, and they've done everything that they've done, to get to what they need to do for themselves, right? To get through the education, right? A lot of times I always say that it's time to close this book and work from your heart, right? So it's in that way that it's just to re-educate them. That's why a lot of times, like I always say to our doctors and nurses, right? It's time for you to start to unlearn what you've learned. Right? So I always say that to them when they come into the clinic, right? It's time for you to unlearn what you've learned, right? Because you see, right? For myself, right? When the 215 came out of Kamloops, right? There was a little bit of animosity with our Indigenous and with our other ethnic ones in the clinic, right? So I kept saying to the ones, I said, all I see is good people doing good work. Good people doing good work, right? And I just kept saying that over and over to them. Good people doing good work, right? You know, so it's in that way that, you know, we have to educate each other, you know, so that we can, you know, all get along in a good way. You know, that's why my prayer is, you know, when we can have all good understanding of each other, when we understand each other's, right, you know, we have more peace amongst each other.
Great. Wow. Thank you very much. Just what a incredible learning journey. Certainly for me, I know that many people are thanking both of you for a really excellent discussion. I think we're getting close to the bottom of the hour, so I think we will wrap up here. But before I do so, I really would like to invite Leslie Bonjour to perhaps do a bit of reflection and also her thoughts on this.
Thank you so much, Kendall. I'm going to give a little bit of a explanation to this, and it's a little bit of a teaching at the same time. During Alana's presentation, she showed a picture. There was a picture of a group, and one included the late Lee Miracle, who's a Stalo sister of mine, passed away just last November. And in our cultural ways, we don't show pictures after someone's passed for preferably a full year, but even longer, until we bring their picture back out. And so I sent Alana a message saying, you know, could you please remove that picture? And so she, of course, graciously said, yes, of course, and not knowing. But the reason I'm bringing it here is because, you know, in our way, I don't know who all the 354 people are here. And so one of them may be a relative of Lee's or, you know, connected to Lee somehow. We don't want them to leave here with that in their heart that, you know, we might have touched something. So I wanted to thank Alana for agreeing to remove the picture. It's a beautiful picture because she was a beautiful life and a beautiful force. And we want her to rest in peace, and we remember her fondly for everything she contributed as a Stolo sister. A beautiful poet and storyteller. I also just thank you again, Alana, for that. Your message was beautiful today. I wish I knew you better. I feel like I know you better now. You understand this work, and that just warms my heart, and that you are humble with your knowledge and you're generous with your gifts. And Elder Bruce, always just love your opening song and prayer and comments. And to Kendall and his team and Laurel, thank you so much. Another amazing, amazing icon event. So again, walk softly out there, everyone. Take good care of yourself and your family. Hug the ones you love, and have some good food and breathe in some good fresh air. Thank you so much, Kendall.
Thank you, Leslie.
Yeah, thank you. And I'd just like to say that to everybody, you know, take care of yourself, right? Because you're important in all the good work that you can be doing to everyone that you come in contact with. Like, you know, as we come together with a good heart, you know, we can all leave with a good heart and a good mind, right? So we can have a good day and the rest of our lives. Thank you, everybody.
Thank you. Alana, any last words before we close?
No, thank you to Leslie for educating me, and my apologies for that error. I will definitely change it going forward. And thank you so much to everyone. This is obviously something dear to me, and I'm just so grateful for this opportunity to share. And as I said earlier, truly what I'm sharing is the lessons that I've learned from the incredible people around me, including Elder Bruce, who I'm grateful to have presented with. So thank you for listening and allowing me to be part of this process.
Thank you so much. I have three short comments and then we'll wrap up. Number one is, I truly feel that spiritually we had just given each other a wonderful hug. And thank you so much for all of you, those that participated, and of course, Elder Bruce and Dr. Hirsh for speaking. and Leslie and Sherry. Really want to thank Vancouver Coastal Health Aboriginal Health Unit and the leadership of Leslie, so that we have an icon, the honor to be able to partner with you. And of course, thanks Ministry of Health for your participation and sponsorship, and the First Nations Health Authority, Vancouver Physician Staff Association, and our organizing committee that include Dr. Jay Slater, Dr. David Hall, Laurel, and also the Indigenous Aboriginal team, Janice, together with Laurie and Sherry. So really a fantastic group that work with. I want to thank my colleagues, Anne-Marie and Suzanne, for organizing these rounds. Finally, we will be having our next round coming up again. So really appreciate everybody joining, and please give us your feedback. Please be safe and feel the warm hug that we all have spiritually. And may we all go on our journey safely and healthily, and have a wonderful Friday. Thank you very much, everyone. Take care.
Doctor.
Thank you.